I think this year ESMO has presented some very nice new data even for breast cancer, both in the metastatic setting and in the early setting. Perhaps in the metastatic setting was where the most important data was presented in the presidential session with the new trial of abemaciclib, but also there were trials in the adjuvant setting looking into extended anti-HER2 therapy, looking into different ways of giving endocrine therapy, and also looking into the CDK inhibitors in the neoadjuvant setting. So all these were very interesting trials that are not yet ready for clinical application, but that are extremely important, with the exception of abemaciclib, but that are very important to determine where we go from here. And in terms of supportive care, so clearly we are discussing more and more on how to provide the same benefit with lower toxicity, or to provide the correct management of nausea, vomiting, and diarrhea. For example, going back to the trial that was presented, ExteNet, of extended anti-HER2 therapy, for the clinical application of those findings, we can only do it if we have a correct control of diarrhea. Otherwise, patients who are in the long-term adjuvant setting will not tolerate a drug that gives high rates of diarrhea. So the management of diarrhea is extremely important for us to be able to provide an additional treatment. And the other part where I'm particularly linked, and we have discussed very in depth, is accessibility, and how can we provide for the as big a number as possible of cancer patients access to the best treatments. And one way of doing that is, for example, developing biosimilars. And we have had several trials of biosimilars of trastuzumab presenting results here, and we have discussed in depth how can we apply biosimilars in the clinical practice, what the clinician needs to know, and how can we save money by doing so. So the other part of accessibility has to do with something people are not so familiarized, namely the media and the policymakers, is that we lack inexpensive drugs that are essential for the treatment of cancer. So they are not expensive, it doesn't cost much to have them, but they are not produced and not distributed. And there are cancer patients in Europe, in many countries of Europe, that are not receiving the best treatment for lack of the appropriate drugs. And so ESMO is working very deeply into solving this issue together with WHO, together with other regulators.